Hey everybody, it's Dr. Richie with Limitless Chiropractic, and I want to come to y'all today to talk about something that I've seen in our community that is a very important topic that we need to cover. And that topic is temporomandibular joints, or as most of us know it as TMJ. And when we have issues with our TMJ, we have something called TMJD, temporomandibular joint dysfunction. And chiropractic can actually help with this. And I want to tell you a little bit of a story about we had a patient and her jaw hurt. And she couldn't chew, couldn't eat hard food. It wasn't fun to eat. There was popping and clicking she felt in the jaw, and it was just very, very uncomfortable. Her mouth, especially on the left side more than the right, it felt stiff. And we were getting her adjusted. She had come in for headaches and neck pain, and she had asked about it. My jaw is really bothering me. And we did some checks on her, and there's certain checks that we have to do to determine whether the temporomandibular joint, or the TMJ, needs to be adjusted, or if the criteria is not there to adjust it. Okay, the joint between the jaw and the skull, it's very superficial, very close to the skin, and we have a nerve called our trigeminal nerve that comes up and around and it controls the face like this. So it's a very sensitive area, and there's only certain criteria that give me the go-ahead or the green light to get that adjusted. Now, when we're looking at TMJ, we can't just look at the jaw. We also need to look at the upper portion of the neck, the top two vertebrae specifically that house the brainstem at different times of the day, the upper portion of the spinal cord, and we also need to look at the muscles of the mouth. So it's a little more in-depth than just, hey, let me get my jaw adjusted and everything should be fine. So back to the story. And we're gonna call our patient, we're gonna call her Mrs. Jones, okay? And Mrs. Jones kept having this pain, and we were adjusting her neck, and her headaches were going away, and this pain started in the jaw, and we did the checks to see. And she met all the criteria that we needed to adjust the jaw. And so as we started adjusting the jaw while adjusting Mrs. Jones' neck, the pain went away. Now, did chiropractic help the pain? Did I cure her TMJ? No. What I did was I was able to help her body put that joint back in the right position, both in the neck and in the jaw, and therefore it relieved her symptoms. And the jaw joint, where the jaw and the skull come together, work a lot like the spine, because there is a little disc in here. There's a disc between the jaw and the skull, and it allows it to glide beautifully as we open and close the mouth. So if there's an issue there, we have to look and see, okay, which way did the disc shift? Did the disc shift forward, or did the disc shift back? Which will determine how we get the jaw adjusted. But Mrs. Jones was able to relieve her TMJ issues through chiropractic care. So if you know anybody that suffers from TMJD, or temporomandibular joint disorder, and want to get it checked out, we would love to have you, because we have experience in this area. We've treated not just Mrs. Jones, but many patients like Mrs. Jones with jaw issues, and we've seen a lot of positive reinforcement and a lot of positive outcomes from that. So the jaw is not just as simple as adjust my jaw, right? There are three components that I look at our office to make sure that we're handling the whole picture. And our goal is not just to help you get rid of pain. Our goal is to help you function properly so we can do our best to make sure that this doesn't come back. So the three things we look at for TMJ, if you have TMJD, the three things we look at are, how is cervical spine function? Number two, do we meet the criteria necessary to even think about adjusting the jaw? And number three, what is the tension of the mouth and chewing muscles, and do we need to do trigger points? So it's likely that some people may need all three. It's likely that some people may need upper cervical spine care as well as jaw care. And some people may just need upper cervical care. We have to see what signs are being presented when we go through the test and the evaluation period. So if you know anybody that's suffering from TMJD and they really just don't know what to do, this is the place for you. Our goal is to help as many people as we can uncover why they feel the way they do. They don't have to choose us. We would love for them to be here, but it's not about them choosing us or everybody has to come to our practice. It's all about getting as many people as we can informed about what their spine looks like. So again, if you know anybody or you yourself are suffering from TMJD issues and you're not really sure what to do, you've consulted with your dentist and you're not entirely sure what the next step is, give us a call here at Limitless Chiropractic. We'd love to do an assessment to determine if you're a good candidate for our office and if you're a good candidate for TMJ care. So give us a call. We look forward to seeing you. Again, I'm Dr. Ritchie, and please be like Mrs. Jones. Ask the question, get evaluated at a chiropractic practice, and let's see what we can do. Have a wonderful day.